Hope, a DMP-led primary level strategy for decreasing vulnerability and healthcare risk for the homeless population. The objectives of this PowerPoint would be to describe the health risk and needs of the homeless population, define the 3 prevention strategies, describe the disciplines that would be involved in planning and implementing the HOPE program. You should also be able to identify at least 2 Doctorate of Nursing Practice leadership competencies that is necessary for developing and implementing the program. You should also be able to identify ways to measure the success of the program. Over 500,000 U.S. citizens are homeless. It is estimated that there are over 4,000 people homeless in Alabama. 70.4% of the homeless in Alabama are in shelters, and 29.6% are unsheltered. This population includes men, women, children, and people of every race and ethnicity. The homeless as a vulnerable population. A large percent of this population includes veterans. The risk for premature death is 3 to 4 times higher than the general public. The homeless have many health risks and needs. The main concern of an advanced practice nurse would be their lack of medical care and how to reduce the barriers. The homeless population is very vulnerable. They are vulnerable in their sleep. They are vulnerable when it comes to chronic and acute health problems, disease, drug and alcohol abuse. They are vulnerable to the police and justice system, society, predators, and violence. Some health risks of the homeless would be hunger and nutrition, lack of access to health care, mental illness, a lack of support systems, chronic disease and pain, environmental risk, behavioral risk, and mortality. Some needs of the homeless population would be food and water, shelter, clothing, health care, transportation, and education. As an advanced practice nurse, one of my main concerns for the homeless population would be a lack of medical care. They have a lack of medical care oftentimes because they do not have health insurance. They have lack of transportation, lack of disease awareness. Some may have lack of trust with medical professionals, feeling of being unwelcomed. They may have also had bad experiences with healthcare and may have an impaired capacity for compliance. Levels of prevention. There are 3 main levels. Primary prevention refers to the process of altering susceptibility or reducing exposure to susceptible individuals and includes general health promotion and specific measures designed to prevent diseases prior to the person getting the disease. Secondary prevention is early detection and prompt treatment of a disease at the earliest possible stage. Tertiary prevention refers to measures taken to alleviate disability and restore effective functioning. Here are some successful community-based programs using primary levels of prevention. Many homeless men and women have participated in community-based programs and were able to start new lives because someone cared enough to reach out and let them know there was a place where they could go and get help. The HOPE program, Homeless Outreach Prevention Plan Efforts. This community-based program will include monthly health screenings that provides immediate needs for the homeless while providing them with education, vaccinations, and counseling. The purpose of the HOPE program would be to reach out to the homeless population and provide immediate needs while providing them with primary level prevention such as general health promotion, health screens, education, and counseling. This program is designed to promote health and awareness in the homeless population. Some goals for the HOPE program would be to meet the immediate needs of the homeless population, reduce barriers for health care, screening for chronic disease and management. This program would also provide education on programs that are available for the homeless population and educate on diseases and management of those diseases. A goal is to also provide them with emotional and spiritual counseling. The overall goal would be to decrease vulnerability and healthcare risk. The DMP would be the director of the program. The shelter would provide the location for the health screens. The church would be there to provide clothes, food, and other immediate needs. I would also get community volunteers to do general delegated tasks. Counselors would also be available for spiritual and emotional counseling, and nurses would be there to conduct screenings and give vaccinations. The role of the DMP would be to design the program and interventions that target the homeless population. They would identify measurable outcomes for the program. They would demonstrate leadership and organization of monthly health screens. They would also develop and evaluate the program's goals, ensure competency, teamwork, and collaboration of volunteers, financial planning and resource management, and they would also evaluate the data received from the program. The required DMP competencies would be leadership. The DMP nurse must be able to lead in development, implementation, observation, and evaluation of the program. They must be able to communicate efficiently with the program participants and volunteers. The advanced practice nurse must be able to work and collaborate with the program, volunteers, medical professionals, church, and the shelter. They must have the knowledge and maintain competency in nursing and caring for the homeless population. They must be also good with project management. They must have the ability to manage the project, set goals, and follow out interventions. Diversity is also important. They must have the ability to work well with others with different cultures and races. Employee development. The advanced practice nurse must have the ability to delegate tasks to volunteers and other medical professionals. They must also have the ability to adapt and change the program as necessary to meet the desired goals for the program. One of the main things I think would be problem solving. The DMP must be able to solve problems that could occur during the program, and they must have the understanding of how organizations work together and utilize resources. Measures of success. Evaluations will take place monthly. The main goal of the evaluation would be asking yourself, were the goals met, and was the program within budget? You could use quantitative evaluation through observation. You would ask yourself how many homeless people were screened, how many were canceled, how many vaccines were given, how many volunteers participated, and how many homeless and volunteers returned the next month. You can use qualitative evaluation through surveys. Did the program create health awareness? Was the information provided informative and useful? Was the counseling provided helpful? And did the program reduce barriers between the participants, the community, and the healthcare? The summary of this PowerPoint: the homeless is a very vulnerable population. More healthcare resources need to be made available for the homeless population. There is a great number of health risks for the homeless. In order to be more successful in decreasing the vulnerability of the population and promote health awareness, you must meet their immediate needs first. Health awareness is especially important in the homeless because of their lack of health care. Knowing the levels of prevention can help the advanced practice nurse develop programs for disease and health management. Evidence from scientific and peer-reviewed articles was provided to show proof that community-based interdisciplinary prevention programs can help with at-risk populations. HOPE can provide health screens, education on health management, flu vaccines, and spiritual and emotional counseling. It is vital to the program that the advanced practice nurse is competent, knows their role, and is able to collaborate with other team members to form a successful program. In order to provide the best quality of care and information, the program must be evaluated monthly for needed changes and success.